Hey guys, so I am a member of a couple of different medical assistant groups on Facebook, and I found this question asked by a member of one of those groups, and so I thought I would address it. So this person says, "Hi everyone, I have a question. I work with eClinicalWorks, and the system is very slow. Sometimes it works fine. How long do you take with a patient that is scheduled for an annual wellness visit? I have a problem with a doctor that says I take too much time with the patient, but then if I miss any info, she starts complaining." So I will tell you, we just transitioned from eClinicalWorks to Epic at the clinic that I work at. Some of our information hasn't quite made the transition over from ECW to Epic at this point. So I don't currently have access to eClinicalWorks because they want everything done in Epic now. But like my preceptor, she still has to pull information to Epic from eClinicalWorks, if that makes sense. So I can't really speak on the eClinicalWorks portion of it, but with Epic, there are a lot of options. I do kind of like how I have the flow of things set up for me. I just kind of go from top to where I need to stop at. I do have like a Medicare annual wellness visit tab that I click on. So like I can access the fall risk screening and any other screenings that I need to do specifically for Medicare. Other than that, like I normally would go through like a domestic violence screening if there's nobody else in the room with them. If there is someone in the room with them, I don't necessarily ask that question because I feel like people might not be comfortable answering that question in front of someone else. I will ask about like smoking history, alcohol, drugs, things like that. Um, Obviously, I get their vitals. I ask them if they have any questions or problems that they've had over the last year that they would like the doctor to address or the provider to address. I work for a doctor, a DO, but there are other providers within our clinic that are PAs, so we do have other providers. Um, but I take as much time as needed. Like, I do try to get things done in an efficient manner, but I feel like when you rush, that's when you forget things. With an annual wellness visit, I also give them a PHQ-9 and GAD-7 form. I do also do like an SDOH, which is a social determinants of health assessment, so that like if they need help getting food or transportation, stuff like that, like we can set them up with the caseworkers that we have. If they need some sort of like chronic care management, we can work with our chronic care managers to set up appointments with them to talk to the chronic care management team. It just kind of depends. Like I said, I do try to do things in an efficient manner, but I also want to take my time. Like, I feel like it's good to get things done efficiently, but I also feel like I said, when you rush through things is when you start to make mistakes or you overlook questions that you need to be asking patients. I will also ask them like if anything has changed with their medical or surgical histories that we need to know about that may not have been showing up in Epic for whatever reason. Like, we can bring in records from other locations. Obviously, that's the nice thing about Epic. Like, you're supposed to be able to, I think it's Care Everywhere. You can look up and pull records from different hospitals that use Epic. It's very, very helpful. I also ask, like, at that time, I try to close care gaps. I try to do that with everybody, unless they're coming in for like a problem-oriented appointment. I may not address those, like if they're coming in for an ear infection or pain in their hip or something like that. Like, I try not to do unnecessary things, but if there's like a care gap that we have in the health maintenance where it's like this person hasn't had a flu vaccine or a pneumonia vaccine, if they come in for an annual, I will try to address all of those that I can. Sometimes they refuse, and you can still address the care gap by saying that the patient refused. Like, the other day, I had a lady who came in for an annual, and it showed that she hadn't gotten her COVID booster, she hadn't gotten a flu vaccine or pneumonia. And so I asked her, I see that you don't have, or that you didn't get your flu vaccine this year. Would you like to get one today? And she said, no, I don't get flu vaccines. I don't get pneumonia vaccines. And she said, I know that I need my booster, but I don't want it. So I simply went through and addressed the care gap, and I put that patient refused. So then it postponed it for another year. So that will kind of close the care gap. So then it shows that you have addressed those things. So it doesn't pop up red, because I kind of don't like when things pop up red, because that means that it's overdue or it's something that you really should have addressed. So I try to make sure that I'm addressing as much as I can. But like I said, patients have the right to refuse anything and everything that they want to refuse. I did have somebody, because she was coming in for a depression problem, and I was trying to get her to fill out one of those PHQ-9 GAD-7s, which, like, it's an assessment that gives you a score based on how you answer things about, like, your mental health and stuff like that. And she said, well, I really don't want to. And I said, if you don't want to, I can just put that you didn't want to, and, like, it's not going to stop you from being able to be seen or anything like that. Because she was worried that if she didn't do it, that she wouldn't be able to see the doctor, that she wouldn't be able to get her medication. And I said, no, absolutely not. Like, nothing like that is going to happen. It's just kind of an assessment that we like to do to see if you need any help in that area. And I said, you have the right to refuse anything and everything that you don't want to do or receive. Like, and she felt better after I told her that. So, I normally, like, with an annual wellness visit, when I'm rooming someone, it does take a little bit longer because there's more questions to ask. Now, mind you, this was also my very first week working full-time as a medical assistant. So I think the average that I took was maybe 8 to 10 minutes for the annual wellness visits. Normally, when I room somebody, it's taking me anywhere from 5 minutes to 10 minutes, depending on the person. Like, I've had some people who were definitely chatty Cathys this week. I also had some people who wanted to show me, like, pictures of their injury, or wanted to put down multiple different comments for the doctor or provider to read while they were being seen. So stuff like that does take a little bit longer. I don't necessarily feel bad for taking a little bit of extra time with patients. However, like, there is a limit to that. I don't want to be stuck in a room with somebody who is, like, talking for 20 minutes. Because if you're getting to 20 minutes, that is a really long time to just be rooming somebody before the provider even sees them. So yeah. Anyways, I wouldn't necessarily feel bad about taking the time that you need to room somebody. And yes, annual wellness visits do take a little bit longer because, like I said, there is additional questions that you have to go through and stuff like immunizations and things like that to take care of as well. So yeah, anyways, that is my gist of things. And if you guys have any questions or topics you would like me to address on the future, on my channel in the future, please let me know, and I'd be glad to get something filmed for you. And with that being said, I will talk to you guys next time.